Hi, my name is Bryson. I'll be your student physical therapist today. How are you
Nice to
doing?
meet you. Nice to meet you.
Before we begin, can I have you confirm your name for me, please?
Carla Ruiz.
Alright, nice to meet you, Carla. I'm just going to be asking a couple questions about what's kind of going on with you. Is it okay?
Yeah.
Alright, cool. So it looks like you're coming in for some lower back pain. Can you please tell me more about kind of how it happened, when you noticed it starting?
I think it comes and goes now and then, but I think it really flared up when I bent down to pick up my dog, and on the way up, it felt kind of like, I guess you could say unstable, and then also the pain came up from there too. Yeah.
Okay. And has this happened before? Like same kind of motions that triggered that?
No, it was mostly sore, but this one's it really flared up a little bit. Yeah.
Okay. Okay. Have you tried any PT in the past for this?
No.
No PT? Alright, I'm glad you're here.
Mm.
Could you kind of tell me, like right now, kind of what things really make it set off?
Whenever I have to bend with my back,
Okay.
yeah, I have some hard time doing things like brushing my teeth, washing the dishes, and maybe doing some handiwork here and there.
Okay. Can you kind of describe the kind of pain? Would you say it's sharp, tingly?
When it says worse, probably a sharp pain. Yeah.
Sharp pain?
Sharp, yeah.
Okay. And you marked it's more on your lower back. Could you kind of point to where you're kind of feeling that pain come around?
Kind of around here.
Okay.
Around here, yeah.
And you also marked you're feeling a little tightness in your upper back area as well?
Yeah, yeah.
Okay.
Yeah, kind of stiff.
Okay. Okay. Could you rate the pain that you're feeling on a scale of 1 to 10, 1 being not so bad and 10 being the worst pain you've ever experienced?
When it at its best, probably a 3.
Okay.
At its very worst, a 7.
Got it. And is there any specific time of day this happens?
No, not really. No.
Okay. Well, you also marked here that you've had an X-ray on this before. Did the doctors tell you anything about what was going on?
No fractures.
No fractures.
No fractures. No hernia. No spinal bulges.
Okay.
None of that, no.
Cool. That's great to hear. Let's see. What do you do for your job, and does your lower back kind of affect that at all?
Yeah, I work in HR for my company, and I
Okay.
have to be on in front of a computer,
Okay.
and I do a lot of typing. My posture is not the best, and I would say it aggravates my symptoms a bit.
Got it. Is the majority of your day sitting down in a chair?
Yeah.
For that?
Yeah, 8-hour shifts.
Got it. On your form, you also mark that you get dizzy sometimes. Is this accompanied with any chest pain at all?
No.
When do you kind of notice this dizziness kind of happening?
I usually get the dizziness maybe early in the morning when I try to get up from my bed pretty quickly.
Okay.
And I sit on the bench and I get kind of dizzy.
Got it.
Yeah.
Okay.
Dizzy, yeah.
Have you had any recent unexplained weight loss or fever, or maybe any trauma?
No.
Okay. Any headaches that feels like nothing you've ever felt before? Okay. And any numbness and tingling
No.
anywhere in your body?
Not at all.
Got it. Sorry, I just have to ask that question.
It's not good. It's not good.
I also noticed that you marked off anxiety or panic disorders.
Mhm.
Are you seeing somebody for that, or is it related to your back at all, do you think?
I think it's just my back.
Okay.
Because I'm not able to just do normal basic hygiene and things around the house. So it kind of makes me anxious to even move around the house for me, and it hasn't been the best.
Alright. Well, hopefully we can get a little bit more function back into your life, and hopefully
Awesome.
you'll feel better with that.
Awesome.
I also noticed you marked off having a hernia. Do you know where exactly that hernia is?
It's a abdominal hernia
Okay.
right here.
Got it.
Yeah. I kind of forgot how it happened, but I have it.
Okay, cool. Well, we'll keep that in mind when we're doing our exercises. But if you feel any pain when we're doing anything, just let me know, and
Thank
we'll
you so much.
stop.
Okay.
So, for this next part of our exam, I'm gonna kind of go a little deeper, kind of assess how your back moves, kind of the range of motion, which things make it hurt, things like that. Is that okay if we start that part?
Mm-hmm.
All right, sweet. So first, I'm just gonna watch. I'm gonna have you stay seated in that chair. I'm just gonna watch as you go from seated into standing.
Okay.
Let me know where you feel pain. And yeah, go whenever you're ready.
Yeah, like on the way up.
On the way up.
On the way up. Yeah.
Okay. And then I'm gonna have you sit back down. Alright, I'm gonna have you stand up just one more time. I just wanna view it from this side. Alrighty. Still the same pain a little bit,
Yeah.
stand up.
Mm-hmm.
Got it. What I want you to do next, I just want you to copy my movement. So first, I'm just gonna go bend over and touch your forearm down to your toes as much as you can. Any pain with that?
No. Yeah. On the way up.
On the way up.
Yeah.
Okay. This time I'm gonna have you slide your arms down your back and reach back as far as you can.
Right there.
Okay, cool.
Mm-hmm.
You can come back up for me, please. Any pain? Not really. Alright, go slide your arm down your leg as far as you can. Any pain with that?
Not much. No.
Alright, come back up. And then other side. No pain.
No.
And then you look over your right shoulder for me. Pain with that?
No, not much.
And then other side for me, please. Anything with that?
Not much. No.
Okay. Next, I'm gonna have you do one more thing really quickly. I just want to see you perform. I'm gonna move this chair out of the way. I just want to see how you would do just a squat for me.
Squat.
Yeah. Okay, and then come back up. How did that feel?
Horrible.
Horrible. Okay, we won't be doing that anymore.
Okay.
But all right, for our next, I'm gonna have you sit on this table for me, please. And so, what I'm gonna be doing, I'm gonna be touching various parts of your leg with this brush. You can kind of feel out how this feels. So I'm just gonna be doing that on the same side on both parts of your leg. What I want you to do is you're gonna close your eyes and you're gonna tell me if it feels the same, different, or if you don't feel anything. Okay, so I'm gonna have you close your eyes for me. It's gonna be brushing your leg. How'd that feel?
Same.
Okay.
Same. Same.
Okay. Could I have you remove your slides? Sorry.
Same.
Okay.
Same.
Same. And one last one. Okay, cool. So, seems like your sensations are working. Next, we're just gonna, I'm sure you've done this before, I'm just gonna be doing a little bit of reflex testing. I'm gonna be hitting this hammer right underneath the
Okay.
calf. Right. Alrighty. This side. Okay, cool. Thank you. So it seems like all that is looking great. Next, we're just going to do a quick little measurement, get specific measurements of how much your spine moves. So I'm going to have you stand up for me once again. Thank you. I'm going to have you turn to the side. And I'm just going to be placing these on your back. Give me 1 second. Right, and whenever you're ready, I want you to bend over as far as you can. And just come back up. Pain with that?
Yeah.
Sorry about that. Next, we're gonna go the opposite direction, so reach far back down as you can. Perfect. Come back up. Thank you. Next, we're gonna be going to our sides. Give me 1 second as I set this up. So reach down as far right as you can. Then around there. Already come back up and then go towards the other side. Alright, come back up. Sweet. For our last one, we're gonna have you place your right arm on this table, and what you're gonna do with this left arm is thread it through as far as you can, making sure your shoulder clears this table.
Okay.
So perfect. Whenever you're ready, thread your left arm through. Sweet. You can come back and then do the same exact thing to the opposite side. Alright. Thank you. You can come back. Thank you so much. Okay, next, we're just gonna be hopping up onto this table. I'm gonna have you go on your hands and knees on this table for me, please. Let me get this out of the way.
Hands and knees, you said this one?
Yes. So, what I want you to do, we're gonna try and keep a flat back. So first, I just want to feel how this feels like. So first, I want you to round your back as much as possible. Sweet, and then go the opposite way. Sweet, and then what we're gonna do, we're gonna go right in the middle of that to try and keep this flat back. Perfect, right about there. Perfect. So holding this position, make sure we breathe this entire time. I want you to tighten up your core like someone's gonna hit you in the stomach. I want you to push out into my fingers. Perfect. Keeping that pelvis nice and neutral. Now what I want you to do, just one arm. Just want to stick your right arm up without movement at the pelvis area, at your hip area. Perfect. Come back to that. And your left arm. Nice. Come back. Now we're gonna make it a little more challenging. I want you to stick your left leg and your right arm out at the same time, keeping everything nice and stable, flexing at your core. And remember to breathe. So go ahead. Okay, we can come back. Restart. All right, thank you. That'll be it for this test. So you come back sitting on this table, please. Sorry, I'm gonna have you actually lay down on your stomach.
Oh my god.
Sorry about that. Alrighty, so now what I'm gonna be doing, I'm gonna be applying a little bit of pressure throughout your spine. Is that alright?
Yeah.
So I'm just gonna be starting around here. And also let me know if it's too painful.
Okay. A little bit, right?
Painful?
Yeah.
Okay.
Right.
Okay. Painful there. Alright. Alright, I'm just gonna have you stay there for 1 moment. Alright, I'm gonna have you face down. Oh, actually, right over here for me. What I want you to do is bend over. So your hips are in line with the edge of this table. And just like this, I'm gonna be pressing down on your first side over here.
Okay.
Just get in that position for me. Perfect. I'm just gonna be applying low pressure. Let me know if there's any pain with that.
Okay.
Pain with that?
No. That one, right? Yeah.
That one?
That
Okay.
one, yeah.
Okay. With this painful segment, I'm gonna have you raise your legs off the table. You can grip the table
Okay.
for some stability there. I know this seems a little silly. It'll be fast, so raise your legs off the floor. Did that make your pain any better?
Makes it better, yeah.
Okay, you can relax me. Thank you. I know that's a hard one. Alrighty, now that we've done all those, I think I have an idea of what's going on, but I want to run a couple more tests to kind of rule out things for sure, and then maybe potentially rule things in. So I'm gonna have you lay on your back for me, please. And you can rest your legs. Perfect. Alright, I'm gonna be applying a little pressure to your hip area. Let me know if it kind of recreates that pain. Alright. Any pain with that?
No.
No. Alrighty, I'm gonna have you lay on your side for me, please. Doesn't matter which one. I'm gonna be applying a little pressure here. Any pain with that?
No.
And then flip back towards me. One more time. I'm gonna apply a little pressure on this side. Perfect. Any pain with that?
No.
Alright, cool. I'm gonna have you lay back down on your back, please. For this next one, I'm gonna have one leg straight. We'll do that, and then I want you to bring this leg like a 4 right over here, and then I'm gonna be just stabilizing here. I'm gonna be pushing down through your knee. Let me know if it recreates your pain.
Okay.
Any pain with that? All right, we'll go to the other leg. It's gonna be stabilizing here. Any pain with that?
No.
Okay. All right. Moving on to our next set of tests. We're gonna be going back to the chair. We're gonna redo your sit to stance, but this time I'm gonna kind of cue you and cue you into the correct motions and see if that changes anything for you.
Okay.
All right. So I'm gonna have you sit back up. Bring the chair back over here. Maybe let me move this chair a little bit more forward. That should be good. Alright, so when I noticed you first did your sit to stand, you used a lot of your lower back as your main mover. What I want you to really focus on this time is try to use more of your legs, have more of that motion come from your legs, and instead of having your back flex or round, I want you to keep more of a flat back.
Okay.
And also when doing this, I want you to do the same bracing technique that we kind of did on the table earlier. So touching your products, I'm just going to hit you, touching out your sides, and then what I want you to do is lean forward, but don't round at your spine. Just lean forward with that same flat back, and then while going up, I want you to try and remain upright. So before you begin, upright posture, perfect. Now I want you to lean forward. I want you to brace while breathing, and I want you to stand up, keeping that back as straight as possible. Great. Did that feel different from the first time?
That felt good. Felt good.
Less pain?
Less pain, yeah.
Perfect. That's what we're aiming for.
Okay.
I'm gonna have you sit back down very slowly, hinging at your hips. All right. We're gonna do that one more time just so we can practice that. So go ahead. Remember, upright. Keep that back straight. That look great. And then this time when we're going down, I wanna cue you to push your butt back. It's called a hip hinge.
Okay.
So we're gonna push our butt back. We're gonna keep that back straight again.
Okay.
And we're gonna slowly lower ourselves while keeping that upright posture. Yeah. Perfect. And did that feel better?
That felt better, yeah.
Alright, great. So that concludes all of our tests. I have a good idea of what's going on. And let's talk about our plan going forward. So what I basically found is that nothing is really wrong. You just have a little bit more motion in your lower back as what is normal, which is totally, again, nothing's wrong. This has been shown to help with physical therapy a lot and respond well to it. So to kind of take away that motion so it's a little less unstable, we're gonna work on the muscles that help stabilize your spine. Why I suspect, because it had a little bit more motion, things like picking up your dog, that could because there's a lot more motion that could have set off that strain because of that extra movement. So if we do things like bracing and stabilizing and working on the strength of those muscles, then that can kind of take off the stress of your lumbar spine.
Awesome.
I also noticed you're very tight in your upper back. I'm sure you noticed as well. So if we work on that mobility as well, then that could also take off some of that strain in your lumbar spine. So, but for today, what we're going to be doing the earlier exercise when you were on all fours. We're going to really work on getting that core brace nice and stable, and then we can progress through that.
Okay.
Do you have any questions for me?
No, I think it sounds good.
All right, thank you so much.
Okay.
Let's begin.
Thank you.